Hi, Amanda. You remember me, Debbie, with
Yeah,
Inhabit Home
Debbie.
Health.
Yes.
Thank you for allowing me to have time to meet with you. I had been speaking with Stephanie up front, and I was telling her this month we're focused on urology. And with that focus, I just wanted to mention some of the ways as a home health agency how we can help some of the patients who maybe exhibit signs, maybe they have recurrent UTIs, or let's just say they have a Foley catheter in place, things like that. So I wanted to ask you, how often are you seeing patients who come in with urinary tract symptoms like that?
We see a lot of the older population here, and we do have quite a few patients that have recurrent UTIs,
Okay.
honestly.
Okay.
We do also have a few patients that have the long-term catheters in place,
Okay.
too.
Okay, so you do see that population. Also, when I think about it, urinary incontinence amongst the elderly is a very, significant occurrence. And last month, or actually 2 months ago, when we were focused on fall prevention, I know I mentioned it several times to other clinicians how those with incontinence, they could become a fall risk because they tend to dribble urine, they could slip and fall. So as well as that, that's another thing to consider as far as the, urinary issues.
I never thought about that way, but you're right. Just them trying to get to the bathroom quickly.
Yeah. So some of the ways, thank you for sharing about the types of patients you see, but I wanted to show you some of the tools that our nurses use and how we can help manage those patients. For instance, if they have a Foley catheter in place, and let's just say you're considering discontinuing that catheter, we can help with that. We can manage the catheter, discontinue it, and do voiding trials to see how the patients do right there at home, so they don't have to come in and you don't have to take your time, because that's not something y'all can bill for, is it?
No, it's not, and it's
Okay.
always hard to fit those patients in,
Yeah,
too.
so that's how we can work with them. We provide this tool, it's called a zone tool, and we explain it with the patients how we're helping to manage that catheter.
Okay.
Letting them know we want them to be in the green zone and so forth. And the other thing I wanted to talk about was just the frequent UTIs that you mentioned. So, if there's a need for lab draws, things like that, our nurses can help with that as far as, they're at the patient's home, so that way they don't have to come in if that's an issue for some of the patients. I know with some of the elderly patients that can be a concern. Our nurses provide a lot of education with the patients, and especially for the disease process. Maybe they've already had a problematic, maybe kidney disease, things like that in the past, where, they've had issues with recurrent UTIs. So we can do some education with them. And I already mentioned the lab draws, and, just kind of being there to monitor and manage those kinds of issues that they might be having.
That would be good, because I see a lot of these patients, and even the confusion it causes sometimes, and for lack of better terms, those repeat offenders that are continuously coming in for the same reasons, and sometimes I just don't really know what to do with them. It's always just the antibiotics, and
Right.
and then they're back in here. So it would be nice to have other
Resources,
absolutely.
And to, with the education, it also can help reduce the risk of rehospitalizations. So we ask them to call us first. That way, rather than going to an ER, going to an urgent care. But we also have access, we've been using, just if there's a real emergent need, one of the places we use, it's called Dispatch Health, so they can be seen, let's say it's in the night, evening hours after y'all are closed, things like that, to help the patient. The other thing, we can also do telehealth visits with our nurse. We have a nurse who does that if there's a need. Maybe it's a day that we're not scheduled, our nurse isn't scheduled to go see the patient, and so they can do a telehealth visit. But we always have someone on call if it's after hours as well. So, there's a lot of ways that we can work with your patients. How does that sound?
That sounds really good, because I really feel like some of these patients just need that overall oversight in between them coming in here symptomatically. So that would be great. I actually have a patient that I'm thinking about that I've seen a couple times in the last few months, that maybe we could try with you and see if they're interested in doing the home health.
Okay, that would be great. And of course we really like to work with your Medicare population, but we do, as I've mentioned in the past, we do accept other payers. But I just ask if we can have some of those Medicare patients as well, just to balance things out. That would be ideal.
I understand. Fortunately, I do believe that this patient I'm thinking about is Medicare, so that would be a great way to start.
Perfect.
So, yeah.
Okay. Well, you let me know. Do you want me to talk with your referral coordinator?
I think I would be fine with that, and you could reach out to the patient yourself and see.
Okay.
I know they've kind of been desperate, just getting frustrated too with the overall disease process. So perhaps you can get them on service and
sure. What's the patient's name, if you don't mind?
Oh, it's Betty Smith.
Okay,
Yep.
Great. I want to go ahead and I'll talk with Celia, the referral coordinator, and just kind of see what I can
I
get.
know that's a common name, but her birthday is 1/1/2000. Actually 1911.
1911.
Quite,
that's unusual.
She's quite one of our superstars.
Oh,
very
that sounds
over 100. So
okay. That sounds good. I'll definitely talk with Celia and get a face sheet, and if I can just reach out and I can have the conversation with Ms. Smith, I'd be happy to.
Okay, great. Thank you for your time. Take care.
Thank you.
Good to see you.
Same here. Bye-bye.